My name is Diala Tie. I'm a cardiologist at Weill Cornell Medicine, and I'm also the director of the Hypertrophic Cardiomyopathy program. The symptoms of hypertrophic cardiomyopathy are quite varied. The most common are shortness of breath and fatigue with exertion. Other symptoms can also be palpitations, chest pain, and in rare instances, loss of consciousness. When you're first being evaluated by our hypertrophic cardiomyopathy program for suspected HCM, you'll run through initially some basic testing to help establish the diagnosis, such as a transthoracic echo, which is an ultrasound just from the skin surface. And then following that, we do offer cardiac MRIs for pretty much every patient with HCM. It can be helpful to confirm the diagnosis, but also to allow us to evaluate additional diagnostic features of the muscle of the heart. And so we're able to look for things like scar, for example, that may end up impacting the care that you need to receive. And then following that initial imaging, you'd also expect to be offer genetic testing as well as genetic counseling for you and your loved ones. We would also then evaluate your heart for any abnormal rhythms, which some patients with hypertrophic cardiomyopathy are predisposed to. And so that would involve wearing a monitor. And then depending on that initial workup, we may also offer stress testing to further evaluate how your heart responds with exertion, in addition to kind of an ongoing analysis, at least year by year, repeating certain tests, and then other tests we repeat at longer increments, like every 2 to 3 or 3 to 5 years. And also as part of that initial evaluation, we try to figure out, who else in your family needs screening, not just genetics, but even, clinical screening. After the initial evaluation, you may be recommended certain medications to help treat your symptoms of hypertrophic cardiomyopathy. You may also be offered certain procedures if your evaluation would warrant them. And so the procedures that we offer include alcohol septal ablation, where we can reduce the thickness of the heart using minimally invasive techniques, without open heart surgery. We also offer, of course, surgery for removing that very thickened part of the heart, which can really help improve symptoms over time. And in addition to that, because some patients with hypertrophic cardiomyopathy may have abnormal rhythms of the heart, if need be, we work quite closely with our electrophysiologists to not only discuss medications that you would benefit from, but also potentially EP procedures such as ablations. In addition to a small subset of patients who might benefit from defibrillators. And so a very full holistic evaluation, and no matter where you fall kind of within that spectrum, we have the expertise to help you navigate. I think it's really important, if you're even kind of considering whether you may or may not have HCM, to really seek an evaluation. It's pretty easy and non-invasive to do the diagnostic testing. And so if there's a concern, either based on family history or based on symptoms, certainly I would recommend anyone in that position to be evaluated by an HCM program.